Here are some suggestions about using cannabis to make your chemotherapy experience better. Cannabis may have potentially dangerous interactions with medicines like blood thinners, so check with your healthcare provider. Safety first. So THC and CBD, the active ingredients in cannabis products, can decrease nausea and that blah feeling you get during chemotherapy. If you inhale THC, the effect usually starts around 20 minutes and lasts for an hour or two. If you take THC by mouth, the effect starts only after an hour or so, but it can last for 4 to 6 hours. We can take advantage of these time differences. So the night before and every night for at least a week after your chemo session, we suggest 5 milligrams of THC at bedtime. This can help you sleep, which is important. The morning before your chemo session and every morning for at least a week after, we suggest something like 5 milligrams of THC and 25 milligrams of CBD when you wake up. The THC can help prevent nausea, and the CBD will cut down any side effects of the THC so you can function better. If you already are nauseated or vomiting, you can hold 5 milligrams of THC liquid in your mouth as long as you can tolerate it. The onset time will be around an hour or so. You can vape 1 to 2 puffs of THC. The onset time is about 20 minutes or so. You might get a buzz with this, so don't drive, cook, skydive, or do any other dangerous activity. Tell your friends and family what you are doing so they can keep an eye on you. You can use cannabis together with other agents in an integrated plan to handle nausea. Nausea is like a hole you can fall into, and it is way easier to stay out of this hole than it is to dig yourself out. Different types of anti-nausea drugs work on different parts of your brain. The ones in yellow can be particularly useful. So have many types of drugs working together for you. Your healthcare provider may prescribe some of these, so see if you can find yours here. And you may want to ask for others on the list. Try to stay ahead of your nausea. Get your anti-nausea drugs on board before chemo to prevent nausea, and keep them on board for a few days after. One way to figure out what is working for you is to keep a simple diary. Just a notebook with 3 columns. Date and time. How are you feeling? And what's going on right now? Reviewing your notes after a few days can really help figure things out.